But when you look at the new data that the Pennington Institute has pulled together, just break down the key findings for us.
Well, unfortunately, the overdose toll is continuing to increase, and so it's actually been more than the road toll for nearly 10 years now. That's the sort of scale of the problem, but it's not talked about very much, and it's possibly not talked about, I think, because of the stigma and shame that we've got around drug use issues generally. If you look at it from a population perspective, it's the second or third leading cause of death for men and women in their 20s, 30s and 40s. There's been a massive increase amongst people in their 50s, but it's really touching people from all walks of life, and it's about the same now between regional and rural Australia and the cities. So, and you know, most overdoses happen at home, so it's not something that's in the public square nearly enough, but we're losing people at an extraordinary rate.
What's the drug most commonly found to be behind these overdose deaths?
Opioids are still the biggest driver of the overdose toll. They're about 50%. Benzodiazepines, such as sleeping tablets and anti-anxiety drugs, are right up there. About a third of all the deaths are benzodiazepines. So, but then it includes stimulant drugs like methamphetamine or cocaine, and obviously it also often includes alcohol. Most of the deaths are polydrug deaths, and it's usually a combination of pharmaceutical drugs, legal drugs like alcohol, and also illegal drugs like heroin or cocaine.
And what did the data show when it comes to overdose deaths amongst Indigenous Australians?
That's an even worse picture, to be honest. It's nearly 4 times worse than the general population. It's got a heavier load in relation to methamphetamines or stimulant drugs, but the overdose toll amongst Indigenous Australians is extraordinarily high compared to the rest of the community.
The report didn't just highlight what we're seeing in terms of the trends in overdose deaths and the numbers, but it also had 5 key policy reforms to help make some change in this area. What were these?
Well, we really want to actually have a mature conversation. We're very mature in our conversation around drugs in Australia. Think about America. There's a vice presidential candidate with credibility from a conservative jurisdiction who legalised cannabis. You know, the conversation in Australia is still a really simple punch and judy approach. So we think the first thing is education for the community, especially around the signs of overdose and how to respond in an emergency situation. If it's an overdose that's related to opioids, that includes naloxone, the overdose reversal drug for opioids. That's not nearly enough available or understood in the community. So really, flooding the community with understanding around overdose and with naloxone will save lives. But we need to fix the hopelessly inadequate opioid substitution treatment system in Australia. We're not meeting current demand, let alone having the capacity to scale up. And there are other interventions as well, such as thinking about drug checking services. We need much more transparency around the drug supply. It's increasingly polluted. And the fact is, we've got to have supervised consumption sites. They do save lives.
Well, pill testing is often something that's included in the media conversation, and there is evidence to show that that is effective in reducing drug-related deaths at big events like music festivals. And we've seen that introduced in some areas in Australia, but there is a reluctance in other areas. Would you support more measures like pill testing?
I think those sort of services like drug checking are important because they improve community literacy around drugs and what's in the drug supply. And we're seeing in recent times extremely potent synthetic opioids, even found in cocaine. And so having drug checking, not just at dance parties, but I think accessible to people generally, is an important step towards improving our health literacy and also providing an opportunity to refer people into healthcare, especially if they've got dependence issues.
Do you think that politics sometimes gets in the way of action in this area, effective action, and in what way might that play out?
I think we've got a real disconnect between what the community thinks around drug use issues, which is that we can't arrest our way out of these problems, and a political class that are sort of stuck in the past. They're stuck 50 years ago thinking that a law enforcement approach will work. We still put 2/3 of the budget into law enforcement. Less than 2% goes to harm reduction, which includes some of that drug checking and community education work. So we've got a real disconnect between the political class and the rest of the community. And I think that's the opportunity for a more mature conversation. I think the politicisation of drug policy is really unfortunate. We'd be much better off with a sober approach, but a health-led approach.